We've now introduced a new opt-out scheme in England, and while they haven't been directly involved in the decision making around that, they definitely contributed to that conversation, and they worked on the Wales were ahead of England in terms of introducing the opt-out, and they formed part of some of the research that went into that as well. They've helped create guidance on how to Black and Asian minority ethnic communities around organ donation. You know, there's a very distinctive difference in terms of the levels of organ donation within those communities compared to white communities, and there's kind of people are working on the ways in which we can close that gap. They've created guidance on how to conduct ethical bereavement research. So a lot of research where you're going and talking to people who have recently bereaved, and they've come up with a framework for how to best achieve that, and how to because you obviously have to be very careful in the way you work on your research. And so that's forming one of our case studies for REF, and I know that they had very strong links with the university, and it's not as simple as going to you guys. Oh, you want impact? Well, go and get a part-time, work half at the university and work half at the hospital. It's not necessarily that simple, but it just shows that if you have a strong link with a hospital or with an organisation where your health research might be impactful, it can have a really strong impact in terms of actually achieving that impact overall. We've fairly recently appointed 7 new people who are part employed by the university and part employed by the hospital. So they're 0.8 hospital, 0.2 at the university. They're all, we call them the clinical medicine research professors. They're all consultants in their fields. We've got a couple who work in the gastro research. We've got someone who works on hearts. I think we've got a hematology consultant. We've got a couple who work kind of neonatal and gynecological research as well. So working in all sorts of things, and we're having some really nice conversations with them because it's a new project, and we're really hoping that as a result of them being formally part of the university, we're going to see a lot improved research and improved impact as a result. We recently formed a partnership with the West Midlands Ambulance Service, and it's the UK's first kind of ambulance trust in terms of having that linkage with the university. And we're hoping that it means that we can start coming up with research that's very strongly linked with the paramedic research, paramedic science, and we can improve the research that we're going to try and do. I'm going to have a go at the classic. I'm going to try and play a video. I need to stop sharing my screen because I haven't shared the audio yet. I think I've shared the wrong screen there, so bear with me 2 seconds. Right. So I thought I had the video ready to go. I do have the video ready to go. So if it doesn't work, you can find it on the link on the PowerPoint, which obviously you can't click, but it's
important because what it does is bring together 2 major organisations that focus on the development and training for paramedic staff. And what we want to do is to make sure that we focus on that training, focus on that development, look at the research needs for the future, and plan an even better ambulance service.
Well, we're really pleased to become the first university ambulance service in partnership with the University of Wolverhampton, 2 great organisations doing great things, really ambitious for the future, and the partnership together will mean that we can create even more evidence for improving the ambulance service across the country, not just in the West Midlands, but also to create better training opportunities and better development for our staff so that we can provide even better care for patients and ultimately save more lives.
Okay, so let's go back to the slides. So yeah, we haven't seen anything come out of this as a result yet because it's a very new partnership, but we're hoping long term that this will be something that we'll see. But again, it shows just that linking up with an organisation, having them work on your research questions from day one, and you're going to have much more impactful research. This is an example of another case study that we're producing at the moment for refs. So this is Neil Galbraith, David Boyder, and Daniel McFeeters, who all work in psychology, and they've been working on a number of workshops with West Mercia and West Midlands Police on stress reduction, suicide awareness, in kind of frontline bodies such as the police and nursing. We see a much higher rate of suicide than we do in other areas, and so that's where their research is really working on. And they're hoping that these organisations are going to update their internal policies to deal with these issues, and we're actually starting to see that as well. And just from having a workshop and just talking to the police and saying, you know, will you update your policy as a result, and they're getting some traction out of that. And one of the interesting things, when I was in a session with David a little while ago, and he was asked to be part of the case study. He wasn't really sure what impact was to begin with. This was about a year ago. He hadn't really thought about it in the way that I asked him to think about it. And then as he thought about impact in a different way, and they started coming up with these workshops, he said in the session I was in that he's now completely thinks about impact in a completely different way. And as a result, his research is much, it feels like it's going to be much improved in the future. So it was kind of a positive story to come out of that thinking about that impact side of things. CyberPsychology. So just an example, again, CyberPsychology is part of another case study we're writing. And if you didn't know, in cyberpsychology is kind of a new field of psychology, newish, and we've got, I think, probably the biggest cyberpsychology unit in the country. And one of the things they got asked to do was to come consult for Channel 4's Circle. If you've not seen it, it's a reality TV show where people sit in these flats and can only talk to people through kind of blind social media. So what they can do as a TV show is they can introduce, in kind of Big Brother style, a person pretending to be someone else and all sorts of things. And our academics, so Chris Forward and Alison Atchell-Smith, and possibly others as well, kind of gave some consulted on how they could approach those psychological aspects and how the psychological implications of being online and all sorts of aspects. So we know that we averaged about 1 million viewers per episode in that first series. It's gone on to second series. It's opening up in USA, France, Brazil. So we've got huge reach. And we know that online there's been a huge public debate around catfishing and all sorts of things as a result of this TV show. So we feel like we've actually got a reasonably strong impact as a result of what these guys have been up to. And they've been doing other things as well. This is an interesting project as well. This is one that really interested me when I talked to Sati. So Sati's a researcher. Again, she's in psychology. She's also a health researcher. She kind of spearheads a lot of the research we do into IBD and colitis and Crohn's. And she does a lot about how to raise public awareness in terms of that, particularly in the South Asian community. And there was an event fairly recently with Maggie Aycliffe from the art school, and she kind of tasked art students with creating pieces on the subject of IBD colitis. And one of the most interesting, I felt, pieces of art that came as a result is this sari you can see in the bottom right, which is actually a microscopic image of a person's gut who has IBD turned into a sari. And in terms of being a novel impact, you know, there aren't many more kind of novel impacts we can talk about. And so what this kind of represents is that interdisciplinary impact that we see, and it's something you can really think about. We have some quantum physicists at the university, and I had a conversation with them at one point about why don't you link up with the arts and culture side of things, and we can maybe come up with some quantum physics art and all sorts of things. So you don't have to just think about within your field the impacts you can have. By diversifying, you might actually find that you're having more impact in different ways. If you go on YouTube, there is a documentary that's come out fairly recently that the university produced called Living in Silence. I think you just have to search Living in Silence. And it's a video about Sati's project and the project they've been doing, and how they've been looking to kind of increase understanding of IBD in general. And this is the last one I'm going to talk about. This is kind of an interesting one. So we've got Professor John Howell and Dr. Sarah Jones, who have been working on a non-hormonal male contraceptive. So obviously the main female contraceptive pill is hormonal. Well, there was all sorts of attempts to make a hormonal male contraceptive that has been unsuccessful so far, and they're working on a non-hormonal one. And in terms of trying to remember the science of it, it penetrates the sperms and basically stops them swimming. And in 2016, it was kind of just randomly picked up by who was the first? The first, it might have been Sunday Times. I can't remember exactly who was the first. And as a result, all the other newspapers suddenly picked up on it, and we found that it was spread. Their research, messages about their research was spread across all sorts of newspapers in UK, abroad. They appeared on Lad Bible. They appeared on all sorts of different websites, and they were asked to appear on an episode of Horizon as well. And this is one of the ones we're finding really tricky to turn into an impact case study, because they've had huge amounts of reach. We can show dozens of different websites that are read by thousands of millions of people, but we can't really demonstrate the significance, because partly because it was 4 years ago now, and it's quite hard to find the debate around it. But we're working on things. We're using a bit of software to try and root through all the different comments and the places it's been shared and all sorts of things. Because you can think about, if you appear online and it's shared on Facebook, then those people share it, then it's shared on Twitter, and then those people share it on something else. It's very difficult to know exactly the spread of the message that you've had, but it's something we are working on to try and find the significance within this. But it's exactly a really excellent example of, if you thought about how you were going to collect evidence of impact from day one, we'd be having a much easier time of it now than trying to retrospectively find evidence. So how they achieved impact. So the End of Life Care Group, with Maggie and Wendy, they have partnerships with organisations from day one. They're practitioners themselves, so they know the kind of research they're looking for. The Mental Health in the Police Project, so they literally just went and approached those organisations through their contacts and said, would you like us to come and do some free workshops with you? And then we can see what kind of impact we can talk about afterwards. You offer anything free to anyone, and they're always interested. CyberPsychology kind of just maintained an online presence. They, as I said, are the biggest cyberpsychology group in the country. And as a result, when, I think this is how it happened, I might be wrong, and I don't think Chris is on this session to tell me differently. But essentially, I think the people from the circle just found, they were looking for who were experts in the field to come and consult, and they found them because they had a decent online presence. And that's a key thing as well. If someone searches your research or searches terms similar to your research, are you appearing near the top of Google? What can you do? Can you blog more? Can you be on social media more? That sort of thing. Digestive health. So Sati's getting her impact from interdisciplinary collaborations. She's collaborating not just with the arts side of things, but she's also collaborating with Matt Brooks, who was the image in the of the clinical medicine professors I mentioned. So he works in IBD research, and she's working with him as well. So she's getting her impact through collaborating. Male contraceptives is a tricky one. Like I said, it was basically seemed just luck. A journalist came across their research, and then suddenly it ballooned into a much bigger thing. So these are all sorts of different ways we can think about impact. Right, so that kind of ends the slides for me on health and well-being. So we've got just about 9 or 10 minutes. If you've got any questions, I'll have a look through to see if there's anything that we've had so far. But if you've got any more questions, just feel free to type them in the chat bar, and I'll see what we can answer.
A question from me, Ben. For PhD researchers, perhaps people who, because some people write their own proposals, but others might apply for a program that's being designed by their supervisors. If they're already working on a project, how can they go back and retrospectively put in those pathways for impact, to kind of sprinkle those seeds? So if you're halfway through a project, what might be the one of the most effective and easy things to do to start that process?
Well, yeah. So that's the kind of main way we're talking to our researchers at the moment is, well, they've been working on a project for 5 years, and now you're asking me to think about impact, and I've got to retrospectively go back and figure out what to do. You know, like I said, the best way of achieving impact is trying to plan it in from day one, but it would just depend on the research. We'd have to think about what you'd done so far, whether you'd had any publications already that actually could have some traction in the wider world, and maybe we should reinvigorate them or write them up into something else, or what we could do. So it's one of those. It's a bit of a cop out, but it would probably depend on the person and the research. And it's something that we're happy to have a chat with people. Just because you're a PGR doesn't mean we won't sit with you for an hour and talk about your research if you want to. So feel free to email that. I'll put it in the chat chat bar again. Feel free to email that email address, and then we can set up a meeting. As long as hundreds of you don't start asking for it. I'm quite busy at the moment, but I will happily sort it out at some point.
There's a question there from Ben Halligan.
In terms of trying to find data from 3 to 4 years ago, what kind of lessons can we learn, take forward in terms of ensuring data is collected at the time of impact? So like I said, with what we're doing with the male contraceptives now is we've asked someone in the computer science researcher called Hiram Patel. He's got some software which basically can go through and find where these news articles were shared on Facebook, and then he can pull out all the comments that people have made. So this is one of those, be careful of your online presence, because actually people can find stuff out you've done a long time ago, and it's public as well. And what we can do is we can have a look back and go, right, these are the comments that were made. But if at the time, if we knew that these things were coming out in the news, we could have advertised hashtags, we could have advertised all sorts of things. We could have inspired more debate by asking questions about male contraceptives. So one of the debate basically a lot of people say is, would a wife trust her husband to take the male contraceptive? Or, would a female trust her male partner to do it, or whatever? And a lot of people go, oh, I would never trust my husband to do that. And a lot of men are going, of course it's not a problem, I can do it. And it's an interesting debate, but really we only have bits of information about that debate. If we could have instigated that debate, we could have had an online event where we discussed it, and we used John and Sarah's research to inspire that debate. If we'd had that at the time, we'd have a much stronger impact case study that we could use, but unfortunately we don't currently. So we're really trying to work reactively and retrospectively, and it makes it a little bit more difficult. Thanks, Catherine. Deborah could answer that question a bit better than me probably, but I think we're working on, because we've only been in a year, and we've basically been trialing different sessions and different ways of working, training the PGRs on impact. I think we're going to be coming up with new ways of doing it. So at the moment, I think the sessions we've done previously, they're probably going to be very, very different. So it's hard to say exactly what we're going to be doing, but if we get good feedback on this the way we've done this session online, and people have gained a lot from an hour or an hour and a half of this, then we might continue doing that. But we have other ideas as well, so we'll just have to see how it happens in the future. We're also working on, I think I spotted Hamlet's name in the list at some point. I don't know if he's still here. Before the COVID situation happened, we were looking at forming a small group of PGR students to kind of be an impact working group and come up with opportunities for PGR students to engage more with the public with their research was kind of the main aim. It's on pause a little bit at the moment until we get sorted, because it's obviously very difficult to put public engagement events on right now. But as things go forward, you might hear about this working group, and people are free to potentially ask if they can be a part of that as well. So just keep your eyes peeled, that might come out. So we've got a couple of minutes until the start of the science and engineering session. If you've got any more questions, feel free to ask. If you're staying for the science and engineering one, there'll definitely be 10 or 15 minutes to talk about things. So